I have a son. His name is Cannon. At 18 months old, he just was not meeting his milestones. He wasn't sitting, wasn't standing. He also started to lose his baby teeth very early. I just noticed a couple things that didn't seem quite right, and our pediatrician just kept telling me that he had low muscle tone, he needed to have physical therapy, he wasn't going to be our athlete child, and so we knew something was off. Went to many different kinds of specialists, never got any formal diagnosis except putting him into physical therapy. And when he was just around a year and a half, we took him to Children's Hospital of Philadelphia, where he was diagnosed by a diagnostic research team with hypophosphatasia. And I had never heard of it before. It sounded really scary to me. I looked around for the patient group to connect with, and there wasn't one. So I quickly, thank God for the internet, went online, did tons of research, found a couple patients. Of course, one was in Germany, one was in Canada, spread out from around the world, and just knew that we needed an organization to advocate for patients. And so that's when Soft Bones was born back in 2009. So we are a patient advocacy group. We are a 501c3 nonprofit, and we really educate, empower, and connect patients, doctors, caregivers, and we do a lot of work with research. We have a grant every year that we give out to young researchers to help to stimulate new interest in the field. We also work with our industry partner. We have a drug that was newly approved for hypophosphatasia, the first ever, which was really exciting, and that happened in October. So we work with the company that helped to develop that drug and work with them very closely to ensure that patients are getting what they need. And then we just work with on DC to help to make sure that rare bone diseases have funding. There's a continued interest in understanding that rare diseases have a really important place in really understanding mainstream diseases. Because you learn something about bones and everything is so connected. You know, that's why the endocrine meeting and having bones and that being a metabolic process is so connected, because you learn something about a rare disease and it may end up helping you learn something about something like a more public health issue like osteoporosis. So it's all connected, and just making sure that rare diseases and the patients have a voice. So our main audiences are research, healthcare professionals, and patients. And we really do something for each audience. For healthcare professionals, we help to provide them with materials to help educate their patients and also to educate the physicians. You know, while we're not necessarily doing CME or any kind of continuum medical education for the doctors, we help to support them and connect them with those opportunities. And then on the patient side, we'll provide them with the materials to have better quality conversations with their physicians. So it's really kind of a 360 support. So knowledge is power, and I think that one of the things that we do that's really unique is we bring patients and doctors face to face to have those conversations. With rare diseases and so many conditions, you have a one-on-one interaction with a physician, and the physician makes their decisions about that patient based on what they know about that one patient, especially in rare diseases where they're not exposed to many different kinds of patients with a disease. So what I find is giving a patient, a doctor that opportunity to have a conversation, and having lots of patients able to come in and engage with the physician. The physician changes the way they think about that disease. And I've had so many doctors say to me, you know what, I completely am changing the way I think about hypophosphatasia and how I would treat it based on these conversations and these meetings. So what we do here at this meeting is we have patients actually staffing our booth at Endo, and they're having conversations with doctors that are coming over to them and saying, here's my story about hypophosphatasia. And those conversations, again, just fortify that physician experience so much and provide a unique perspective that they wouldn't get in their clinical practices. I think that just really, again, it's a consumer message about knowing your numbers, that kind of campaign where you get that blood work and you may not really understand what it is. But if you're on the low end of a spectrum of a range, or if you're even flagged for anything, take that extra step to go to research what could be behind it, because it could be a key to a bigger health issue that you're not realizing that you have. That pain is probably being caused by something, that joint issue, that fracture in your foot that doesn't seem to heal very well. There's a lot of people who just kind of go through life accepting these things as part of getting old, or just part of, this is how I am. And a lot of times there's an underlying condition that's triggering that they can be taking steps to address. So really empowering yourself to take that step, and knowing that your doctor may not be doing that for you. It's an important thing that you could take as kind of your own caretaker of your health.